Dental implant is less painful than pulling out a tooth. With the new techniques that we have, it's easier and faster. That's the most important questions. They think the implants are for the old people only. Actually, it's for everybody. People that have 17 years, 18 years old, they can put an implant. No, the implant is inside of the gum and the bone. So when you put a crown, it's the most important to put zirconia crown that looks more aesthetic. So you're not gonna have any problems and looks very natural. No, actually it's the same. The only thing you have to brush very well your teeth and use the floss. If you go with a specialty doctor and with the new technique that we have, normally you have 95% of success. No, normally when you arrive here, we have to do the diagnosis and then we can do actually immediate loading using the implant. Either way, if the implant don't have very good stability, we can still doing something temporary. But it's very important that when you finish, you have to live with a temporary tooth. It's not expensive. Actually, if you think when you have a missing tooth, to make a new bridge that you have to do preparation for the next tooth, you are destroying natural tissue and actually it's very close to the price than have an implant. So the only difference is you have to wait 4 months or 6 months to put a crown. But actually, if you put it on the time, it's better to conserve your natural tooth than making a bridge. So it's not that expensive. With the new technique and the new materials and heal faster, so normally it takes 3 months and then you can put a crown with a problem. Sometimes you can put the implant and actually you can put a temporary loading with the implant that you put. It's not true. You can have disease, but it's very important to go with the doctor and control the diabetes and the high blood pressure. It's very important for your health, but actually you can still have any implants. Depends on the bone loss. If you have bone loss only in one surface, we can still do bone graft and membrane and create bone in that area. But if you don't have bone and then you don't have any teeth, there is new technique like Zygomatic Implants, Debunked implants that we can still use for the upper, and then you can continue your life normal.